with Dr Priya Verma, who some of you may have seen from our one-to-one consultations. We are going to be talking all about skin tightening today. And we are actually going to leave a little bit of time just for a question or two, because I know Dr Priya loves to answer questions from the floor. So I'm going to jump straight into it. And first and foremost, let's just get it out all on the table. What do we even mean, Dr Priya, when it comes to skin tightening? And why are you the best person to be talking about it today?
Thank you so much, Becki. It's a great question. I think it's a really good starting point for this discussion. What do we mean by skin tightening? Essentially what we're trying to do is to firm up the skin structure. So it's in essence a treatment that is trying to remodel the skin from within. And if we think about why does the skin become lax over time, it's because of a breakdown of certain protein structures like collagen and elastin. And so skin tightening, really the objective here is to try and stimulate the production of these essential proteins like collagen and elastin and improve the matrix and scaffolding of that deep dermal structure.
And how much tightening is really possible? We hear a lot about sort of tightening or like sort of firming, etc., all the way from skincare to surgical and non-surgical. So what can we actually do, and how much should we measure our expectations?
Again, a really, really vital part of the consultation is trying to ascertain and manage a patient's expectations as to what we can truly achieve. So if you're coming in with a concern of lax, sagging skin, then we've got to understand that there's a number of different treatment options based on the severity of the skin laxity. So if you've got a very early, loosening of the skin in the lower face, for example, we might be able to treat that with non-surgical options, using energy-based devices or using injectable treatments. But if you are someone who has got, photo-damaged skin, we've lost a lot of collagen in the skin, you might be postmenopausal, all of these different things, the physiology changes within our skin, so then the treatment might have to be different. If we've got quite obvious sagging tissue, then sometimes there's no better alternative than to think about surgical options. So it's about being realistic, really. When it comes to patients' expectations and what they're requiring, I think more and more patients want to have minimal downtime, they want to see results, they want to see them quickly, and they're not willing to necessarily disrupt their life too much by undergoing surgical procedures. So that's where we come in. Practitioners who are offering non-surgical treatment options where we can try to get as close as possible to a result that you're happy with, but understanding that there are going to be limitations of just heating the skin. Now, I actually perform a lot of energy-based device work in the clinic that I work in, and the idea is just to do those things we were talking about, stimulating collagen production, stimulating the elastin, improving the scaffolding of the skin, trying to firm up and improve the way the skin looks, not just on the outside, but improve the health of the skin on the inside. And a lot of what we're doing with energy-based devices is, yes, using thermal injury to the skin to trigger a cascade of skin healing. So it's almost coming under the umbrella term of regenerative aesthetic medicine. The way we're using energy-based devices now, it's really about kind of, trying to get your skin to switch on a biological process and start that cascade of healing so that we get more collagen production. So, one of the things that I specialize in is the Endolift laser. And so what I always say to patients is, yes, it's, ideally, in theory, when you have any kind of looseness of the skin, you can, in theory, tighten it with Endolift. But the results will vary based on, how much sagging tissue there is, the heat that we put in. And so that's just a conversation that needs to be had.
And so you mentioned the Endolift, which is a very exciting treatment. If someone is intrigued by what that is and what results you can get for skin tightening with it, could you just run through what a consultation and treatment experience might be like, just so that people can feel like they know it and it's a little less, not nerve-inducing, but they're prepared?
Of course. So Endolift is quite different to a lot of the other energy-based devices out there at the moment, because although it's a laser, it is a laser that is passed internally in the skin. A lot of lasers that we know and understand are light energy that converts to heat energy, and a lot of them go on top of the skin, right? This is very different. It uses a micro-optical fiber, which is like a thin little yellow wire. We tunnel it under the skin using a tiny microscopic thermal burn to the skin, which once you remove the wire, you can't even see where you've gone in. It's that small. And what we're doing is we're passing this micro-optical fiber back and forth into the areas we want to treat. So if it's the lower face or the neck, for example, what we're doing is passing it back and forth directly into the layer that stimulates collagen. So you don't have to go through the outer layers of the skin, you go direct to source. And by going into that deep dermal layer, what you're doing is you're waking up the fibroblast cells that make collagen. You are then, being very targeted with your heat delivery. And if you wanted to, you can also melt little stubborn pockets of fat. Because this is a heat device, it's a laser, we can adjust the settings on the Endolift so that we could generate a little bit more heat in patients who require a bit of fat melting. So if you've noticed, as you're getting older, you might develop little stubborn pockets of fat under the chin or in the jowl, which is blunting the jawline. And these can be really quite hard to treat using other cosmetic procedures. And even if you try to lose weight by conventional means, diet and exercise, sometimes you just get those little stubborn pockets of fat that don't want to shift. And so Endolift serves as a really wonderful adjunct to other lifestyle choices as well, whereby you can just directly deliver heat into that pocket of fat, melt it through, but also tighten the skin at the same time. And I think it's important to mention that when we think about fat melting, some of the more traditional methods of melting or removing fat might be, for example, liposuction, where yes, you remove the fat, but you don't do anything for the skin. And so then you're left actually looking a little bit worse because you've removed the pocket of fat, but then you've got loose hanging, redundant skin. So Endolift is sort of that two-pronged approach where you melt the fat, you tighten the skin all at the same time, and that bioremodeling continues for, a period of sort of 6 months where you see your final result. And then you get really nice longevity out of it because it's often just a single session, which tends to last you a good 2 to 3 years in a lot of cases. So I hope that kind of summarizes what Endolift is about, how it's used. And, to finish off, we can say that we can use it, yes, anywhere that there's loose skin, but primarily we use Endolift on the lower face, under the chin, on the neck, but we can treat it on the body. We can use Endolift on the body as well to treat, postpartum skin laxity. So abdominal skin laxity after birth, which just doesn't recoil back the way that it used to. Or if you've got sort of loose skin around the inner knees, the thighs, we can use it for cellulite reduction in the buttocks. So there's lots of different applications for this device.
Right, it sounds very exciting. I could speak to you for a long, long time, but I would love to know if anyone does have a question in the audience before I carry on. Lots of interested but perhaps nervous looking faces. No, we're all good. Right, I'm gonna power on slightly. So when it comes to sort of overall, let's say, tightening of the body versus the face, which you touched on, do the treatment protocols quite differ? You mentioned about sort of tailoring how the levels of the Endolift. Could you talk a little bit more about perhaps how those differences show themselves, and also who might be most suitable for the treatment?
Absolutely. So yes, there's lots of applications of it, but we have to recognise that the skin on our face is very different to the skin on our body. The skin on our body tends to be thicker. It also tends to have a larger amount of subcutaneous tissue, so the fat content tends to be higher that's sitting directly beneath the skin. That then in itself poses slightly different challenges for us. So typically, patients seeking Endolift treatment for the body will have concerns about sagging loose tissue, but also perhaps more stubborn pockets of fat. So the way the Endolift will differ from perhaps the face, where the skin is a little bit thinner, the fat content is a little bit less dense, is in terms of the wire selection. So like I said, we're using these micro-optical fibers. They're like these little wires, and they differ in their size. So if we've got more fat to melt, we need to choose a larger wire, which delivers a larger spot of light energy and therefore heat energy. Because then what you're doing is you're just able to disrupt that matrix in the body skin much better and be capable of melting more fat if needed. And so that you get a punchier treatment. The other thing with the body is that a lot of my patients come with concerns such as cellulite. Now, there's a conversation to be had about cellulite, which is that it's very common, and in a way, I try to normalize it with patients instead of jumping straight into let's treat that, because cellulite is something that a lot of us are going to experience, whether it's in your kind of late teens, early 20s, or if it's hitting you in your middle age after you've perhaps had weight fluctuations or given birth. It tends to catch up with most of us, and so a mild degree of cellulite, I think, is considered normal. It's not something that really should be disrupted. It's essentially a tethering of the outer skin surface or outer skin layer to the subcutaneous fatty layer underneath. It's these tethered little bands. And so I always judge whether it's something that is of a major concern to a patient, because of course if it's really bothering you and it's impacting you, then sure, if we've got a treatment option for it, we can certainly try it. And so Endolift is also wonderful, not just for tightening the skin and melting fat, but also breaking through those tethered bands from stubborn cellulite. And what we find is that it's almost used as a subcision device. And subcision is just the term used to describe a tool that breaks through connective tissue. And so whether it's scarring or whether it's cellulite, we can actually help to disrupt the matrix when it hasn't healed properly using Endolift. So patients have come to me not just for cellulite for the body, but also post-surgical procedures, and they've got scar tissue. So we can use the heat from this laser to just break through that scar tissue in order for us to stimulate new collagen, so the collagen lays down in a more organized fashion and leads to a better outcome and better kind of integrity of the skin.
Obviously, I feel like when we're talking about lasers, we should probably discuss how inclusive lasers are or perhaps are not. Who is a good candidate for Endolift and skin tightening devices, perhaps more generally, and perhaps who does need to be careful or speak to a specifically trained practitioner?
So as with any aesthetic treatment, it's important, it's vital to have a consultation beforehand, because without consultation, you're pretty much going in blind. When it comes to lasers, these are energy-based devices. It's a machine that's plugged into the wall and it's capable of putting energy into the skin, whether that's in the form of ultrasound or in the form of heat or light energy. It is doing something to disrupt the skin. So when we talk about who is a good candidate and how should we choose the right candidate for different lasers, it depends on a number of different things. The first thing to think about is, if you're putting light energy into the skin, how will the skin react? Well, it's dependent upon the wavelength of the laser. So there's lots of different lasers out there, and they all come with a different number. And all that means is, it's almost like radio stations, isn't it? I mean, it's looking at lasers look for a target in the skin. And there are three main targets, one of which is, for example, hemoglobin, which is blood. So there are vascular lasers that zap some of the capillaries in your skin to reduce redness, for example. Then you've got lasers that target melanin, which are important for, say, laser hair removal, because they're great for darker hair types, and it just goes and finds that melanin pigment and zaps that, reducing kind of pigmentation issues, but also great for laser hair removal. And then you've got lasers that are really useful for targeting water. So that's another target within the skin. And when we have a laser used to target the water, it's going to be targeting the dermis, which is a skin layer abundant in water. And the end result tends to be tightening and contraction of the skin when you're zapping the water. So when we think about laser, we've got to firstly think about what is the wavelength of this laser and what is the target within the skin. So what's your primary concern? Is it redness? Is it pigmentation? Is it that you've got a looseness of the skin? The next thing you need to think about is the skin types of the patient. So if you've got laser that's going on top of the skin, then is there a risk of thermal damage to the top skin layer? And if so, is this skin color type going to be able to withstand that heat? Because there are certain lasers that go on top of the skin and they can vaporize or burn off the top layer of your skin. And so you might get rebound pigmentation if you've got a darker skin type, for example. Now, the great thing with Endolift is that it's an internal laser. So this laser wire passes under your skin and we tend not to see any pigmentary problems, which is why it's acceptable and totally viable to use on all skin types, ranging from the fairest of skin to very, very dark browns as well. So that doesn't preclude you from treatment whatsoever. And, it's down to consultation, of course, but, it's a laser that can be done all year round. So I always say, circumstantially, you've got to think about, yes, how much downtime can a patient tolerate? But also, do you have any major social commitments? Because there's going to be an element of redness, swelling, bruising, any cosmetic procedure that you do. So choosing the right patient, but also choosing patients who understand that there is a degree of aftercare required. You might need to stay out the sun for certain ablative lasers, for example. Now, Endolift itself is a non-ablative laser. It doesn't burn off the top layer of your skin. It is an internal laser and it's actually quite low levels of heat because it's just trying to disrupt the matrix of the deeper skin layers. And so you get very minimal downtime. You can use it all year round on all skin types. And actually, it's wonderful because you find that there's collagen stimulation happening as early as 1 month in. But for a lot of patients, on average, it's about 3 months in that you start to see results and improvement, with the final result around 6 months. And it gives you a longevity of about 2 to 3 years in a lot of cases. So, I hope that encompasses sort of who's a suitable candidate. And of course, grading the skin laxity, which is something we covered a bit earlier. So if you've got very severe kind of sagging skin, Endolift alone is not going to be sufficient. And we might combine that with injectables to revolumize the face, and perhaps think about even ablative lasers. So we can do a number of different lasers at the same time to target outside skin texture, Endolift to tighten the skin and stimulate collagen, and then perhaps revolumizing the face if you've lost volume. So it really does require a consultation and an in-depth treatment plan, which we can organise for anyone who's interested.
Wonderful. Thank you so much, Dr. Priya. It's been wonderful speaking to you, and I hope everyone really enjoyed that. If you do have more individual questions, Dr. Priya, please do grab her, or as she says, come in to the clinic for a consultation. So thank you very much.